It was not easy to get into. I will say that. It was not at all. And it actually took a couple of years to break in, even though I was coming with a vice president title.
Welcome to Career Plug. Hi, welcome to Career Plug. Thanks for joining me. Today, I have a very special guest. I am pulling on my personal resources. So please remember to like and subscribe as I dive into career exploration, provide insight to careers. This is not for me. This is really for you guys. Like me and my friends, like we're fine. But what part of what we would like to do is, again, provide insight on careers. So today, without further ado, very special guest. Her name is Roxanne Barnes Mosley. I know her very well. She is the wife of my best friend. So I want to take a minute to welcome Roxanne to the show.
Thank you.
How are you today?
I'm good. How are you?
I am good. I am good. Thanks so much for taking time to join me at Career Plug. This is the second interview. I interviewed Sanders Adu, who you know, um, a lobbyist for Wells Fargo, and provided the audience with insight into his career, his lifestyle, sort of the day-to-day activities, excuse me, of being a lobbyist. So you are my official second guest. I'm still very early in the process, but just a pleasure to bring on guests who have intriguing careers. So again, welcome. My
Thank
first,
you. I'm honored.
oh, thank you. My first question is, what are you plugged into these days?
All right. What am I plugged into? Let's see. You mean personally?
Yes.
Audible.com is my favorite. I'm in my car
Okay.
a lot. So, Audible, music, let's see, travel, and the majority of my time is spent on a soccer field. So, women's soccer is my absolute favorite activity right now.
I love that. I love that. And because I know Roxanne very well, I can provide a little bit of insight. Part of that soccer inspiration is she has two daughters, one who is like a young phenom, my niece. And we are so proud of her. But yeah, so that makes total sense. The kids, audible for a little bit of away time while you're in the car and
Yeah.
travel.
Yes. Yes. My favorite travel.
um, I want to get into sort of just, briefly you and your background, where you're from, your parents, college. I, of course, know you went to grad school, but if you could just provide the audience with a little bit of brief background.
Sure. I grew up in Oak Park, Michigan, a suburb of Detroit. I was fortunate enough to go to University of Michigan, the greatest school
Woo.
in the world. Go Blue. I majored in kinesiology, and at the time, my plan was to go to medical school for sports medicine. So after college, I decided I wanted to postpone medical school and go away to get my master's. So I moved to Charlotte, North Carolina, and went to University of North Carolina, Charlotte, got a master's in public health. And while I was there, I decided medical school probably was not the route that I really wanted to go. I was more interested in the public health aspect of healthcare. So I stayed in North Carolina for a while. I worked as an instructor at a community college. And then
Oh,
my
wow.
first job, yeah, that was fun, but
Well,
short lived.
that's news for me. Yeah, that's great.
Yeah, Yes. And my very first job out of graduate school was actually working in the HIV/AIDS space as a case manager. So that was interesting. Not my favorite job. It was rewarding in terms of helping, but it was, quite sad. So it pretty much run its course. So after that, I moved on and became a director and then a vice president of the Arthritis Foundation for North and South Carolina. So that was the start of my career.
Oh
So
wow.
yeah, so that was the early days.
And so early days, that sounds like from probably what, 22 to what, 26 or so?
Yes.
27?
Yep,
Okay.
exactly. Yep. 20, yeah, 26, 27. Yeah.
Okay. So you came out of college, gunning, top great school. A lot of people, a lot of young folks, Gen Y, Gen Z, there's a lot of chatter about folks not going to college. I am still a believer in college. It is not the
Yeah.
only way, but
I agree.
yeah, still the majority of people are going to college. Like, yes, there are other methods to educate yourself. YouTube obviously is a space that's moving. It's moving quickly. Online education is gaining a lot of momentum, but there's something about the college experience generally that just can't be replaced. And the number of people you can meet, across the world, and the networking aspect it will provide for
Yeah.
your life going forward. But anyway,
Yeah, you can't put a price tag on that. And I feel like it's exactly what you said. You can choose a career that doesn't necessarily require a college degree, but the
mhm,
experience you get from just learning independence, networking, the life skills, you can't put a price tag on that. So I agree. My kids know college. That's the plan.
correct.
Even if they decide to be entrepreneurs, college is the plan.
Listen, Uncle Gene is behind that, of course. So I don't think they don't have a choice.
They
They
don't
will
have a
face
choice. They don't know any different.
they will face massive resistance.
Exactly.
Uh, so, as I know, you moved to Los Angeles and said goodbye to North Carolina. I assume part of your journey to LA was, just the bigger city, the lifestyle, the appeal in your 20s of, moving to a great city with weather and environment and, energy. So tell us a little bit
Mhm.
about that transition.
Oh, yeah. I mean, who does not want to live in Southern California? Everything that you mentioned is the reason why. I had aspirations to live in California since I was probably 10. So it was an easy decision. It was New York or LA because I feel like
Mhm.
at that time, those were two cities that you moved to. And you probably know this. Like a lot of your
That's
friends, you
right.
either moved to New York or you moved to LA or maybe Chicago. But New York was like my second home. I grew up all of my life going there. So for me, sunny California, palm trees, the beach, you didn't have to tell me twice. So
I
when
love
I
it.
moved, so I didn't move. The interesting thing, a lot of people think, okay, you moved to a big city with a job. I did not. So I moved to LA, utilizing my degrees. I consulted with a few nonprofits, the 100 Black Men in Los Angeles. I also consulted with another community organization that was providing home supplies and clothing to people who were in need. So I
Oh
did
wow.
that for a couple of years. And then even starting in North Carolina, I had decided that I wanted to investigate, if you will, pharmaceutical companies. So,
Hmm.
working at the Arthritis Foundation, part of my job was acquiring sponsorship. And if anyone knows the nonprofit world, most of the sponsorships come from if it's a health nonprofit, comes from the pharmaceutical world. So my exposure to pharmaceutical companies was very in depth when I worked with the Arthritis Foundation. And I just remember one day when you work in the nonprofit world, no matter what your title is, whether it's director, VP, fundraising, programming, you do everything. There is no set
Gotcha.
job description, and it can easily burn you out. And I had decided, as much as I love the nonprofit sector, I wanted to go into the for profit world and then use my time and resources to help in the nonprofit world. So that was my pivot. So I started to investigate certain pharma companies, started to put feelers out, and it was not easy to get into. I will say that it was not at all. And it actually took a couple of years to break in, even though I was coming with a vice president title. It took a while for me
Wow.
to break into the industry. Yeah.
So thank you for those gems. I mean, listen, you can't get this information unless somebody tells you. So here you started in a nonprofit environment that was exposed to, sort of healthcare and that industry. And so, you were able to get a peek into sort of like pharmaceutical sales and what that involves. And then after deciding to try to pivot, it then with a master's degree and a VP title, it then took you almost 2 years to, you know, get into actual pharmaceutical sales. And so how did you ultimately, was it mainly through networking? Because, keep in mind, audience, that what we're saying is this, like it is important to arm yourself with the education and credentials necessary to even knock on the door of an industry like this. And when you have those plus experience, she's telling us directly that it was still not easy after that. So,
Hmm.
yeah, if you could just kind of go into a bit of the of converting into um, and actually getting hired, for your first position.
Sure. It was a process. Exactly to your point, it was having the right resume, the right experience, because going into pharma, and I think this is with every job, you need the education, but you also need the experience. And how do you get the experience? So, how do you tailor your career path to gain the experience that you need? So, for me, I had the educational background, I had the science background. I could take, a clinical study and read it front to back and understand what it meant and be able to articulate that to doctors. What I didn't
Wow.
have was a sales background. So it's interesting. So I had to get creative. And this is a pretty funny story. A friend of mine, this is going to tell our age, all the way back to there was a
Mhm.
company called Melaleuca, which was a wellness company that sold everything. If I recall, everything they sold involved tea tree oil because back then tea
Okay.
tree oil was a hot, one of the
Right.
hot
That's
wellness
right.
items to have in as an ingredient. So I had a friend who was doing it was multi-level marketing. She was selling Melaleuca. So I was like, I need some sales experience. So can I join your team? Let me set up, my own little business, sell business to business so I can gain some business experience on the side. So that was my creative way of gaining experience in sales because I had no experience in sales. It was all in healthcare, like I said, science, teaching, working in the nonprofit sector. So that was the way that I got sales onto my resume.
Love
So
the
at that point, which is
creativity. Wow.
something so simple, you would think, but having that on my resume actually helped to flag my resume higher in the pool of resumes that were coming in. Um, because I don't know how much our audience knows this, pharmaceutical sales was very, very popular at that time and still is. So you take one job, one position, one region, one territory, you might get 1,000 applications for that one job. So in order to flag your resume, you have to have keywords on it that will, make it rise to the top for a recruiter to even take a look at it. So that was my goal. I was like, I need to get sales on my resume. So that actually helped. And I don't know, it's just the rule of life. I had
Right.
no bites on my resume for 2 years. And then all of a sudden, I had four different companies calling me all at the same time. So you just never know. So you just have to keep at it. Networking, so many different layers, but you have to come at it at every angle.
Wow. Incredible gems. Like, again, I love the creativity behind like trying to figure out how do I implement, sales in something that wasn't, natural to me at the time, but sort of engage in a way with that where I could supplement my science background and combine the two. So that's uh, that's great. I love that story. Listen, I'm learning a little bit more. Um,
Yeah, yeah, you have to
so
get
your
creative.
first position, yeah. So your first position, what was the title of your first position and what company?
So my first position was with Procter and Gamble.
Okay.
It was a level one sales rep in internal medicine. And in the world of pharmaceutical sales, there's a hierarchy, if you will. Most people start out in internal medicine. And the goal typically is to get to specialty care. So fortunately, I mean, who wouldn't want to work for Procter and Gamble? So it was
Right.
a phenomenal experience. And my science background came in handy, of course. So that was an added bonus. And so it was just a wonderful first job in the industry. I learned a tremendous amount of skills. At that time, Procter and Gamble was big on development. So I
Mm.
got a lot of training in science. We did do sales training, but the interesting thing, every pharma company has sort of their own identity. So Procter and Gamble was known for having reps that had a science background. So I firmly believe that that's what really got my foot in the door and the job. Yes, the sales experience, but the fact that I had 2 degrees, one in science and one in public health, I think that's what got me in the door at Procter and Gamble. So that was in women's healthcare. So I was at P&G at least 3 to 4 years.
Oh
And
wow.
if anybody knows anything about the pharma industry, you cannot get comfortable. And
Yeah.
that is just,
Right.
you just can't. It is a known thing in the industry that every few years there's a realignment, there's a layoff, there's a reorganization. And so after 4 years with P&G, they sold all of their prescription drug business to another company. So at that point, I went on to the other company, which was a very, very different company. And at that company is where I learned how to work in sales. It was so different. So,
Wow.
yeah.
Wow, what a that's a again, she's dropping gems, guys, giving you guys tremendous insight into one, just level one, the intro to getting into a pharmaceutical sales company, and then also letting you guys know like you have to keep your head on a swivel because it's a typical and she probably lasted a little bit longer than the average person, but it's probably a 2 to 4 year window.
Yeah.
It sounds like per company. um, so wow, that's great. And then so what was the day to day? I'm curious, sort of just starting out. What was the day to day like? You hear about things like a company car, you hear about some
Mhm.
of the flexibility, you hear about some of these things with pharmaceutical sales, but like what was it like for you sort of starting out those first 4 years?
I mean, a company car, you can't go wrong with that. Especially living in the city. I mean, anybody who has a company car now with gas, especially in LA being $6 a gallon, it's a
Wow.
blessing. But, I think about it like this. I was in my 20s. At the time, started out not in six figures, but a good base salary at the time. I think I started at 70.
Wow, that's
So
great.
as a 20 something making 70K, company car, um, flexibility, wonderful health insurance, because that is something that is very, very a nice thing about working for a pharmaceutical company. You typically have wonderful health insurance. And in a day and age where, at one point people didn't even want to give you health insurance, that's
Hmm.
always a bonus. So, 401k, all these amazing benefits that in your 20s at that time was wonderful, especially living in Southern California. So, my typical day, there's a lot of autonomy in pharmaceutical sales. So, if you are not a disciplined person, it's probably
There we
not the
go.
career for you because it's very easy to not be disciplined. It's very easy to drive around all day and stop at the mall or stop at the beach or stop to hang out with friends. Like there are so many other things that, might be attractive to you, but at the end of the day, you have a goal to meet. If you want to make the bonuses that are offered in pharmaceutical sales, which by the way are amazing, you have to put in the work. So it really is kind of being like an entrepreneur.
Correct.
So you typically get a set list of or an area of physicians or people that work in the healthcare industry that you need to talk to, target, if you will. And you need to go in and be able to have an intelligent, scientific conversation with them that will help them move the needle forward with whatever you're offering, and in turn, ultimately get it in the hands of the patient to help them. So, a lot of planning, um, a lot of creativity, which is nice, and
Wow.
a lot of discipline, a lot. And a lot of ambition. I mean, those who do well in pharmaceutical sales have to have an ambitious spirit.
Wow.
That's the
That's
goal.
great.
Yeah.
That is great. So my next question was going to be, who would you recommend if, they're in their 20s, like what type of personality and, like who would do well? But it sounds like you just, drop that. Like you need to be ambitious. You
Mm-hmm.
cannot be lazy.
No.
You need to be extremely disciplined because, depending on the city you live in, especially in a place like Southern California or Miami, or,
Lots of
you
distractions.
can, right, lunch can easily go into a run to the beach and, you
Yes.
know, but it will affect you and affect your bonus potential if you do not stay disciplined. And then I would
Mm-hmm.
think also, and look, I don't know if this is a part of it or not. You hear these things, but there is a certain attractiveness you probably need to have in the pharmaceutical industry. And look, I
it,
I think most people feel like you can't say it, but I think most people feel and see attractive people, and it's one of the unsaid things in the pharmaceutical industry. Of course, they do not discriminate against unattractive people. Of
right.
course not.
Yeah.
Everyone has an equal chance. Of course, the world is equal. Um,
Yeah.
but
That's so funny. You know what
but
I
I
will
would think,
say? I will
go
say
ahead,
to
I'm
that,
sorry.
yes, that is something that historically has been something that everyone thinks. But it's
Mhm.
interesting. I will say that the most successful reps may not be what the world sees as attractive.
Wow.
It is, I mean, there's so much more that goes into it. Like I said, you have to be ambitious, you have to be organized, you have to know your stuff. And I think
Mm,
that's also a myth that comes along with this type of position is that people think, oh, all you need to do is go in there and drop off samples. No, that's not it. And it especially depends on what specialty you work in. Now I'm in specialty care, and as you move along in your career or move up in position, you're dealing with thought leaders. You're dealing with people who are doing the clinical trials, who are some of the smartest individuals in the entire world. And
Mm,
if you walk into their office and you cannot bring added value, you might not be invited back in. So you have to know your stuff. So, like I said, learning how to break down a clinical trial, learning how to articulate that to some of the smartest minds in the world, and then
wow.
also being able to understand that ultimately it's not even necessarily about that doctor, it's really about the patient. So, somebody who works in this business absolutely needs to be passionate about helping people. You need to, like we mentioned, be organized. You need to be ambitious and 100% disciplined. And you need to know your stuff. And I think that's one of the biggest misconceptions, that as someone who's been in this industry for a long time, that it gets to be very frustrating, because if you don't understand the business, you fall into the stereotypes. I mean, listen, there's been movies that have talked about pharma reps as if we don't have to have a degree. And let me say this, because that is my number one pet peeve. You
There we
absolutely
go.
have to have a college degree to work in pharmaceutical sales. So I want to put that out there because there is a movie that came out about 10 to 12 years ago that said that you did not. So that is not
Wow.
true. Yeah.
Such great gems. Wow. So you have covered sort of the day to day, the education background needed, the discipline, the flexibility that comes with the job. Um, is there anything that you think, in terms of working for a larger corporation, that is like beneficial? I mean, obviously, you get to travel. You go to events. You just came back from Vegas last week. I assume
Mhm.
some type of convention, and you guys probably had a booth. Where have you gone and moved ahead over the past, let's say, decade? You've,
Okay.
if you could address that a bit.
Sure. So, like I said, I started out in internal medicine. So, from there, I moved into women's health. And from there, I moved into gastroenterology. I worked in urology. And I'm currently in inflammation and immunology. So,
Wow.
specifically dermatology. So, I mean, like I said, you have to be flexible, you have to be willing to learn the science. Each of those specialties, a different drug, a different mechanism of action, different science, different molecules. So, and every time there's a new drug to come to market within your division, it means going back to training. It means, 4 to 6 weeks of hardcore scientific learning, training, exams that you absolutely have to pass in order to keep
Wow.
your job. Um,
Okay.
some of those exams you get one time to pass, maybe two if they're nice. Um, so it's a lot. It's a lot of work. Where I am now, I absolutely love. Of all the specialties that I've worked in, dermatology is probably the most fun for all the obvious reasons. Um, I won't say what product I have, but it's medical derm. But there's medical derm and then there's aesthetics. But the nice thing, it's still all under dermatology. So what I don't know about aesthetics or other medical derm products, I get to learn from my offices, doctors, or whatever additional training I do. So it's the beautiful thing about pharma is that you do well, most companies will support you in either making a lateral move, even a horizontal move. If you want to, I work for a huge company now, and the wonderful thing is that I'm in a program now where I'm trying to figure out what my next move is. And so, because I have had a breadth of experience and done fairly well, the company is saying, hey, we recognize that you have other talents that maybe you're not utilizing right now, or, you know, other career ambitions that you want to try, and we're willing to support you in that. So that's been beautiful. And mentorship is the other thing I want to throw in there. No matter what industry you go into, find yourself a mentor, multiple, not just one, multiple.
Wow.
So.
Wow. Listen, I'm taking notes. I love this. I am taking notes. It is wow, you just dropped a lot of gems. So you are at a huge company now, and just in terms of, listen, I obviously am not going to ask you your salary, but you are doing well. You live in $1 million home. You have celebrity friends. You know that is all part of Los Angeles lifestyle, but you have worked extremely hard. I mean, we just, walked your path over essentially the last 20 years. And
Hmm.
the difficulty of, of this industry and the creative path to get in it. So, just want to make sure, before we wrap up, that you also, because of your excellence, and we're not, just, you know, stating cap on this video for for video
I
purposes,
love that you know that word.
that you received an award not that long ago. Can you fill us in on that, and kind of what's behind that?
Yes, absolutely. So, one of the fun things about working in pharma is that it is competitive. Let's be honest, it is highly competitive.
Highly.
And we're typically given a sales quota or a goal. And those who meet the goal and exceed the goal, you tend to get an award or multiple awards. So at most companies, they have what's called President's Club or Premier. I mean, the most common term is President's Club, and which I just won again this year. And so with President's Club comes a lot of accolades. You get a lot of recognition. You get a trip. I just recently returned from the Caribbean. Um, and it's amazing. It is absolutely amazing. Back to your
Amazing.
other question about different places that I've gone being in this industry. I mean, we have meetings in Vegas, we have meetings in New Orleans. You get to go to all these different conventions and conferences where you're interacting with people from all over the world, people who work in the pharmaceutical industry, physicians, thought leaders. Researchers, your level of exposure can be as much as you allow it to take you. And the networking, you can't put a price tag on. So, and the rewards, you can't put a price tag on. I mean, listen, an all expense trip paid to go to the Caribbean
That's
or to
right.
Europe, who's going to turn that down? Who's
Who's
going to
turning
leave that
that
on the
down?
table? Yeah, so it's a pretty rewarding gig.
I love it. Thank you so much, Roxanne. We really appreciate it. I hope this audience understands the valuable content we're bringing at Career Plug, the insight that you have provided. Any sort of last words for, I don't know, specifically, women
Mm.
between, let's just say, the ages of 22 to 30, or women that are maybe 30 plus that want to make a career change into pharma sales or pharmaceutical sales.
Absolutely. I would say, like I mentioned before, find a mentor. In fact, find multiple mentors. Be flexible. One of the things that my mentor told me, this was just a few weeks ago, we were having a conversation, and one of the things that he said to me, he's like, I know what your goals are, but in order to get there, don't be closed off to other things that may help pour into your breadth of experience. So have a plan. And even if it's not, even if you don't know ultimately where you want to go, just be open and have diverse experiences Be open. As far as
Mm.
women, support each other. However, your journey takes you, always find someone to mentor as well as have a mentor and just go for it. One of the things that I have learned along the way is that as a woman, as a Black woman, don't be afraid to negotiate. Know your worth, know what you
Wow.
bring to the table, and stand firm in it. Again,
Wow.
be flexible, but stand firm in knowing your worth. And if you don't know how to negotiate or you're fearful of it, whatever it is, that's where mentorship comes in. Reach out to someone and don't be afraid, because if you don't ask, you won't get it. And it is very true that your counterpart who may not look like you may be have an offer that's $20,000 above what they're offering you. So just know your value and don't be afraid to ask for it.
Woo! I love this. It's so beautiful. Thank you again, Roxanne Barnes Mosley. We really appreciate this, the insight you
Thank
provided.
you. And
Hopefully,
before we go, I want to say thank you. I wish someone was doing this when I was in my 20s. I feel like what you're doing is invaluable. And for those watching, keep watching, because the more your exposure is to different careers, the more opportunity you will have to be open and get to the level that you want to be at. So I'm so proud of you for doing this. This is amazing. Keep doing it.
my God, thanks. Okay. She's got things to do, people. She got things to do. We
I
appreciate
have
you.
children
Thank you
calling
again,
me.
Roxanne.
Thank you,
All righty.
Jimmy. All right. Bye bye.
Goodbye.